not just in pediatric rheumatology to adult rheumatology, but this is true in really many of the subspecialties. If we think about it, you know, kids with many of our diseases, some of our chronic illnesses like cystic fibrosis, congenital heart disease, didn't live necessarily to be adults. So everything has really changed, over the years in terms of, um, what diseases adults need to take care of. In rheumatology, I think it's especially complicated for a couple different reasons. So the criteria, for instance, for diagnosis are quite interesting. We're in the process of trying to revamp them because the original classification criteria was part of Dr. Barbara Ansell's graduate thesis when she was a young medical trainee in London and then went to work at Tapley with Eric Bywaters, really the father of this field in English. Hence why the criteria ended at 16, because 16 years of age was pediatrics in England. And then at 17, you became an adult. So, the age cutoff is very interesting. And unlike something like lupus, which is childhood onset lupus, and we could argue about whether the classification criteria for adults and pediatrics should be different, I think all of us understand what we're talking about. When we say JIA, we're really talking about a heterogeneous group of disorders, some of which have adult counterparts that are very similar and some of which are not. And so, this is going to affect things in terms of transition because what we call things are different. And adding to that complexity, which absolutely makes no sense, is that if we say as doctors that JIA is JIA forever, so an adult with JIA still has JIA, there are no drugs approved for adults with JIA in the United States. Adult diseases have adult approvals. So when someone has rheumatoid factor positive polyarticular JIA, then we say at 17 they become RA. If someone were diagnosed with exactly the same thing at 17. A 17-year-old with RA does not exist in terms of the way drugs are approved. So we have to call them JIA, which is not what the criteria says. Then when they turn 18, they have to switch to an adult name because the drugs are approved for adults with RA, for instance. So, we change things sort of all the time. And just the complexity of transition is, what the name of the disease is, how we're treating it, et cetera. And the second thing is depending on where you train, especially if you're an internist, I must say, I don't want to take care of 40-year-olds. It's not what my training is in. I don't understand them. I don't understand their issues. They're very different than what I take care of in general. So most of the adult rheumatologists don't get a whole lot of training in, seeing kids and what their experience is. Even if 50% of the kids are taken care of by adult practitioners, which is what people say, the formal training and what happens to them over time is quite different. And we lose that in the United States. People change their names and we change the diagnoses codes, as I just said to you. So we lose a lot of what happens sort of over time and why we might care what the original subtypes were in terms of what's going to happen over time. So through CARA, which is the Children's Arthritis and Rheumatology Research Alliance, we're trying to get some long-term follow-up studies. But apropos of transition, sorry for the digression, when we look at the long-term follow-up studies from the Nordic cohort, and they've been following people for 3 decades, what they find is even when insurance is not an issue, we lose people in that transition from childhood care to adult care. And there's many reasons for it, but even in an area where insurance is not the barrier, which it sometimes is in the States, we still lose them. So, I think the reasons for that are nuanced and complicated. We've moved many ways where I think most 20 to 30-year-olds, for instance, don't have primary care providers. They use urgent care for their health care, et cetera. So, the skill set of making appointments and doing all of that stuff is partially lost. There's just so many reasons that go into it. More transient life, you don't know where you're going to live. You might be doing, graduate work somewhere, then you're going to settle someplace else. I just think there's so many issues that need to be worked out. So when we speak to our MedPeds colleagues, they really talk about formal transition plans. And I think that's something that we need to work on as a group between us, the med peds people with their suggestions because of their knowledge, and then some of the adult rheumatologists who, perhaps have more familiarity and comfort dealing with, the 20-year-old population. And then in transition, we have to bring up one last issue, which is the parents, because it is really typical in the late adolescent years for the parents still to be managing their children's health care. They are paying for it, for one thing. And the children go off to college, and they may very much still be on the parents' insurance. And I will say, for those of us who take care of these young adults, they do not perceive where they're going to college, where they're going to live. So they don't establish care there. So they come down to see us. We see them. We send labs. We want to discuss it with them. We can't find them. We send them messages through Epic because they have to answer the messages. They're adults. It goes to them. They don't respond. You can't call them because, as I would tell you, nobody answers their phone. Nobody's voicemail is set up or it's always full. And we end up dealing them with the parents to relay the messages. So all of a sudden then, when they go to the adult side and the parents are appropriately not part of it, the equation, the children often don't know how to, fare in that transition. So there's a lot of work that has to be done. And many people have come up in many different ways. It's definitely not one size fits all. And it's something we just have to continue to chip away at and make sure that our patients, get seen and all of these different issues are paid attention to.